Hello and welcome to the Small Business Briefing. I'm Brian Calley, CEO of the Small Business Association of Michigan.
Hi, good afternoon, everyone. Thanks for tuning in today. We missed you last week. I want to welcome one of our new elite members. They are Stack Cybersecurity. So thank you to Rich Miller and his team for joining. So Brian, we've talked a lot on the show about the Corporate Transparency Act and our lawsuit, and it appears that it might be settled for now. So the feds appealed our win, but asked to put the case in abeyance. Can you tell us what that means?
Yeah, really for us, we consider this good news. Now, we knew when we won at the local level that it would be appealed. There was a virtually 100% chance that it would be appealed. But because the Trump administration has moved to repeal the previous rules and have proposed temporary rules that will become permanent rules in the future that really scale back the intrusiveness of this new law, the um, the government's not really all that interested in carrying the appeal forward. They don't want to lose their right to appeal, but they don't really want to spend any time and money on it because the rule is being rescinded. From our standpoint, we like this because it means our win stands. So we won at the local level. It protects our members from the Corporate Transparency Act, but then it also it's just in place if the rules ever come back in the future, because that's really our concern now, is that at some point, anything that is done by and then undone by administrative action can be redone. The underlying law still exists. That's what was declared unconstitutional in our lawsuit win. And so in abeyance means it's just frozen. The government doesn't lose its right to pick it up and appeal in the future. We don't lose our win. So our members stay under the protection of the lawsuit itself, the win of the lawsuit and the declaration that the CTA was unconstitutional. And we wait and see if it ever comes back. So we've really kind of put a pin in it for this at this point. Unless there's an about face from the Trump administration and they go more aggressive on enforcement of this law, it might just stay in abeyance indefinitely. And then at that point, it wouldn't be until some future administration decides that they wanted to pick it up or not. But at this point, all good news.
That is good news. Moving on to our next segment, we actually have a special guest who's joined us, Kirk Roy from Blue Cross Blue Shield of Michigan. So Brian, I know you two are going to have a conversation on affordability.
Yeah, this is a big issue for SBAM and its members, affordability of health care, which of course to many of our members, that means health insurance premiums. And so we've got really the expert, Kirk Roy, on when it comes to the actuary. Actually, I don't want to steal your thunder because, Kirk, I was going to ask you to start out by just explaining what you do and a little bit about yourself there, other than the fact that you have two first names, which is really awesome. I like in my brain, I wanted to say Roy Kirk a bunch of times, but it's Kirk Roy. Kirk, go
I
ahead.
get that a lot. They always say you should never trust a man with two first names, except for now, right here. Yeah, but my background is I've worked in health benefits for the last 30 years. I started out helping employers design and build their own benefit plans. Then I came over to Blue Cross, where lots of different jobs, but I currently serve as the chief actuary and ultimately not always the most popular person in the room, but we're responsible for making sure we have adequate resources to pay the claims that all of our members incur. That also means setting adequate premiums, which again is a big challenge for us all in the entire community. And that's why I think we are also thinking not much around how do we just set prices, but how do we get at what's underlying the actual healthcare costs? Because that's really what determines the bulk of what premium health insurance premium is.
I think that's a great place to take the conversation right now because it's one of those areas where every single year, it just seems like year over year, in most years, there's been a few exceptions, but in most years, there are big increases. And I know that employers are constantly wondering like where's the end of this or why is this happening? So maybe let's start with that. What drives the costs? What's the underlying force that is making the healthcare costs go up year over year?
It's a constant challenge, and people who have been in the industry long enough have seen there's been ebbs and flows, like you said, some years up, some years down. What we've seen over the last little while is an acceleration, really without a mechanism from end of some of those rising costs, which is why we're so urgently reaching out to the providers in the community, the business community, to say we've got to do something different. So that's what the problem we need to solve. What drives that problem is ultimately we have a very expensive system that gets used a lot. Start with prescription drugs. Everyone knows that there are new drugs coming out all the time, and they're coming with big price tags. And it's not just, there are some very rarely used drugs that are extremely expensive, but more and more use of tens of thousands of dollars a year, $100,000 a year drugs. Let's start there. So that's step one. Step number two, though, is we've also got every procedure that is done by a nurse, by a doctor, in a hospital, outside of a hospital, is getting paid at a very high reimbursement. And we have an infrastructure that's very expensive that we're building more and more capacity to use more and more of. And then add to that, every procedure that comes out that can be a different way to intervene, different new imaging, new surgical procedures, all that sort of thing. Every one of those is more expensive than the last. And so we have a snowball of high prices, higher mix of procedures, and we're all using the system more. Now, some people say, well, that's just what people need because people have healthcare needs. And we try and look at this. And absolutely, are there things that people have advancing diseases, they have conditions, they have accidents? That's all true. But that's about a third of what is driving, what we see in the data, driving cost. The other 2/3 is, even for a given health condition, we're doing more expensive interventions more often for more people.
Yeah, and it really is, when you took, I think people can really relate to this. Every time you turn around, there's a new medical building being built somewhere. It seems like, obviously inside of that those buildings are people and equipment. And on the one hand, you see that and you hear about shortages, but it seems like all that new infrastructure goes in places where there's lots of other stuff going on, and not necessarily in the areas where you hear about the shortages being either. I think about, like, actually not too far from me, there was like a hospital, and then somebody else put another hospital, and then the other hospital was like, let's put a medical center in between them to make sure they don't get the traffic. Like, that's not really about health, is it? I mean,
That is about building more capacity in the places that can pay for that capacity, and maybe even not building the capacity where there's more need. That is something that we observe. And here's another example. Some people are, I hear stories internally and in the data, I'm having a hard time even getting in to see my doctor. And so we're saying, well, let's surround the doctor with physician assistants, nurse practitioners. We'll get some other people in there. And we're seeing utilization of those other practitioners go up 15 to 17% on top of the doctor's office visits, but there happen to be not in the places where there's deserts. It's in the places where there is already access, but people are getting now more care where there's already access, we see sometimes. So again, do we need access to the system? Yes, we need people to get the care that they need, but we also need to make sure we're putting our resources in the right spots and not providing extra care when there's a dearth of care in other spots.
Yeah, at the end of the day, it's the employers that, especially small business owners, that end up paying the bills for all of this. So let's get to solution mode here then. Maybe give an idea of what's Blue Cross doing? And I've noticed, I've taken note, actually, it almost seems like Blue Cross is the only one who's trying to contain costs in healthcare these days. But what's Blue Cross doing about this? But then also, what can the viewers, small business owners, or just families, individuals, do to contribute to changing or bending the curve here?
There's a lot to that question. So let's try and break it out in a couple different spots. So first of all, Blue Cross has always tried to say, hey, how can we get the best possible price for every service that someone ends up needing, the best possible price for the drugs? We'll continue to do that. But we just talked about, There's a lot of available capacity. The prices are high, so just getting the best price for something that maybe wasn't the best use of our resources isn't really helpful. So we're trying to really lead the way in pay for outcomes and really be thoughtful around how do we want to construct our products and networks around where that providers that are committed to that value are going. So that's our overarching strategy. Now, within that, you sort of said Blue Cross is the only one working on it. I think we're all trying to work on it, but the plan sponsor, right? The employer, the small business, and the insurer that's got to bring it all together. A member just wants their family, themselves to be healthy. The doctor is there. They want to deliver the care that they were trained to deliver, but we've got to make the whole thing work. So I would say that when you're out there thinking about, as a patient, talking to your doctor about what the options are, asking when more care is better, when less care might be better. The number of doctors I talk to who say someone came in and they saw a commercial for a drug, and if I don't write that drug for them, they're going to go find another doctor. I mean, that's not helpful expectations as a patient. So we can all be better consumers and be more thoughtful with that conversation around options. That's what the medical professionals tell me. Then when it comes to, but your benefit plan, I'm the employer, I want to offer my benefit plan. Can't we all make this less expensive? But then secretly they say, but don't change anything else. Don't change how it's administered. Don't change who's in the network. Don't change the formulary. I want my spouse to get their drug that they've been on. We need to make some different choices. And what I always say to employers is talk to your advisor about what other options are. And if we're going to make this thing work, trying to say, well, let's leave everything the same and give 100% choice. And really, it doesn't matter what hospital you go to, all of those sorts of things, not really going to help in the long run. So let's put all those solutions together. And we do have a continuum of options in terms of the benefit cost that you can find a more affordable price point for, and your insurance advisor would give you great advice and options on that. The more control you can give us to allow what the elements are of the benefit cost, the cost sharing, the formulary, and the network, the better we can try and manage the affordability in the environment that we got.
Yeah. You know, it's of course, everything's changing so quickly too. It reminds me of, I went to see my doctor because I hurt my back, ended up being SI joint, is how I described it.
I have the same thing.
Yeah. And so, you know what, I was just amazed by this. He said, look, you're, I take it you're a pretty disciplined person. You know, I run marathons, and he does too. So anyway, we always talk about running, but he said, I could send you to physical therapy, or because you're disciplined, here's a YouTube channel, and it'll say what you need to do, and you could just do it, right? You got to do it. You got to go through the steps, and you got to be faithful about it. But you could do it and save yourself. He was trying to save me time because I'm busy, but it saved money in the system, and probably just made all the physical therapists mad at me by telling that story. But it was, it was the sort of thing where it's like, wow, it was kind of jarring, because very rarely does somebody say, here's a less expensive option. It was less expensive for my time, but also for the whole system.
Yeah, so that's a very interesting story. It's almost like we are not going to solve this problem unless everybody does a little bit of their part. Your example of is, what can I do to control my health outcomes? Not all of them controllable. You are going to need help at sometimes. Some people are going to have very serious accidents or conditions. But if you start with, what can I do? Perfect example. I can do these exercises on my own every day. You will get better. Your body's an amazing machine. The second thing, though, is, but the healthcare providers need to do differently. Being paid on a system that says, every time I see anybody, I can only make 10 minutes work. And the easiest thing to do in that 10 minutes is write a prescription, do a referral, all that sort of thing. That's not helping everybody in every situation. So them practicing differently, and us being willing to reimburse differently. And we have also some large employers that say, but it's easier to track the claims. How do you know if you're really getting value if you capitate and all those sorts of things? We've got to get a little bit different around that. And we've got to be willing to make different choices around what we cover, how much, when, which providers are the ones that are committed to that same set of changes. So everybody's got to do a little bit, but I think your story is a great example of thinking and doing differently in the healthcare system.
Yeah, and let me just throw in also that it's been a few months now, but Blue Cross with in the beginning with Trisha Keith's start as CEO, top to bottom, uh, effort to reduce overall administrative expenses. I think the number is like $600 million over 3 years. And then also some cost controls on some of the pharmaceuticals that were really driving up cost. I mean, just a new class of drugs that was really driving up
Yes.
costs and were being used very widely. But again, employers have to pay the bills for this. And that's why I say, when you look at all the giant players in healthcare, there have been real and substantive steps taken here to try to reduce costs. But now we need the pharmaceutical companies and the health systems that have become these huge conglomerations with a lot of pricing power. With to quote Spider-Man, with great power comes great responsibility. That they have a responsibility to control their costs, and so it requires everybody to do their part. Okay, so Kirk, let's end with somebody. If somebody wanted to just kind of plug in and learn a little bit more about what they could do or what Blue Cross is doing to control healthcare costs, how do they get plugged in?
The best thing they can do is like you said, we've been really elevating the need for a broader change. It's an economic burden to our communities. And so we've been putting out, I'll read the website, bcbsm.mibluedaily.com/affordability is where we have sort of the platform where we're sharing the information we have. We're sharing what people can do, how they can get involved. Because like we said, it's going to take everybody. And the easiest thing for each of us to do is retreat to our corners and try and protect the turf we've historically had. But that is not going to help anybody. And that's why that's the good fight we're all trying to fight. And then you're doing along the way. So I appreciate that.
Very good. Okay, Kirk Roy, thanks for joining us today and shedding light on a very, very complex but extremely important issue. Appreciate you. Thank you.
Great. Thanks, Brian. Thanks for having me.
All right, and thanks, Jacqueline, for sharing that link that he mentioned. All right, so Brian, we
Thanks,
have
everyone.
all right, thanks, Al. We have quite a few things to cover yet today. Next up is that the Army Corps of Engineers has issued preliminary findings on the Line 5 tunnel permit. Any surprises there?
Well, I can't say there was no surprises except for maybe the fact that it was the most logical conclusion I could have imagined, which you don't necessarily expect to get out of government when they do a report like this. So what they did, so to remind people, the Line 5 tunnel, there's an oil pipeline. It's actually two lines because smaller pipelines with a smaller circumference is stronger structurally, so that one pipeline, when it goes underwater, turns into two and then joins back to one. Anyway, that goes along the bottomlands of the Straits of Mackinac. It's been an issue for a long time. People worried about either corrosion or an anchor strike or something like that. And so the proposal was made many years ago, and it's been tied up in administrative and court actions since then to burrow a tunnel 100 feet below the lake bed through bedrock, a dry tunnel that you could walk through. I mean, people won't be able to just walk through, but you could walk through and inspect and see and watch and remove the risk of a pipeline spill. So there's something that that has to be issued, which is an environmental impact study that only the Army Corps of Engineers can do for a project like this. And that got delayed and delayed and delayed for years. And so recently it got fast tracked because there was an energy emergency declared. And so the conclusion that they came to, well, first was the kind of landscape that they looked at. What some of the environmentalist groups that would like to just shut down any use of fossil fuels at all said, look, you should not consider the alternative to the tunnel to being leaving the current pipeline across the bottom of the lake. Well, that is the alternative, though. If you don't do the tunnel, it's going to stay on the bottom of the lake. They wanted it to be reviewed like, don't do the tunnel and just make believe like it just would all vanish or wouldn't be there anymore. So the Army Corps of Engineers thankfully rejected Fantasyland and dealt with just the reality of the situation and said, look, it's either going to be on the lake bed like it is today, or the alternative is put it in the tunnel. And clearly putting it in the tunnel is less risk. And so that was how they looked at it. The other thing that they did was they said, look, for the environmental impact study, we are going to look at the impact of the tunnel, of putting the tunnel in place. What some of the opponents to the project wanted them to do was to consider the environmental impact of the entire pipeline. Well, the entire pipeline there's no permit for the entire pipeline. It's already in place. So they wanted from there all the way to where the refinery is, and and then back into Canada where it originates. That They rejected that and said, no, we're just going to look at the tunnel, the part that would be under construction. What is the environmental impact of that? And so when they compare that to being on the bottomlands, clearly the less risky option is putting it in the tunnel. And so I think well, not I think, this will get challenged. That decision, once it's published and made official, it's already been published, but on a preliminary basis, once it's made official, it will be challenged and it'll have to go through the court system. But I think it's so logical that that at the end of the day, the project is going to happen. I think the Army Corps of Engineers was the main holdup before, and they're not the holdup anymore.
I did share a link here on Zoom and Facebook. It's for a public letter if you want to show your support for permitting. So
Very good.
there you go. All right, next on today's agenda, we have some good news about the housing shortage. Just a few years after we worked with MISHDA and others on the statewide housing plan. So Brian, where do things stand right now?
Yeah, thankfully, there's some progress being made. This has been in Michigan, we've got an much older than average housing stock. And since the Great Recession in 2007, 8, 9, that time period, we have just been short on new construction. And the good indications are coming from the census. So there's an annual census update. There are, excuse me, 22,000 new units that were added in 2024. And so it puts our shortage at about 119,000, still very significant, very big shortage of housing. That's just looking at the population that we have compared to the housing stock that's at a livable standard. And so it's still short, but headed in the right direction. This was kind of, I don't know if I'd say if it was unexpected. I did expect that we would start seeing some outcomes, but it was a bigger bite out of it than what I would have expected.
All right, now tell me about this one, Brian. There's a new threat on the horizon. There's some reports that suggest a ballot initiative is out there to increase income taxes. So tell me about this and what it would mean for small business owners.
Yeah, there's these things always come with like with slogans or they try to put catchy names on it. And this one, the working title that a few of the education related groups are pushing is called Babies Over Billionaires. But unfortunately, this is not a billionaire's tax. It applies to it's a graduated income tax, which right now is not allowed in Michigan. Now our Constitution says one flat tax rate, simple, straightforward system in our personal income tax system. And what they're saying is that 500,000, which is, I guess, these days counts as a billionaire, 500,000 is a threshold where the rates could be increased. what a lot of these people that push ideas like this don't understand is that there are how many businesses are pass-through entities where the business itself, all the business income appears on the personal tax return of the owner. Even if if the owner doesn't take any income or doesn't take that much income out of the business, it all gets recognized there. So these graduated income taxes, especially at the state level, they backfire. What happens is the super wealthy can live wherever they want. They can change their domicile. They can escape taxes like this. It's the small business owner that is anchored in the community and really can't domicile in a different place that just has no choice but to pay the tax. And it's unfortunate it's being pushed. And the hook is they're going to try to um, they would have to have a public vote on it. And in this public vote, they would seek to raise income taxes over $500,000 and then have it to go to schools. That's the way that they are pushing it. Now, there's nothing in there about um, performance standards or improvement requirements, transparency or accountability for outcomes in education. And Michigan's education system really, even though funding has gone up a lot, and I do mean like a lot in the last 4 or 5 years, the performance has gone way down. It's been dropping relative to the rest of the country each year, unfortunately. And so it really is a bad idea, and one that unfortunately it would be that kind of middle middle income business. So small business and mid-sized business would be at the heart of who would be paying this new tax. So they still got to get signatures, but if somebody does say, hey, would you like to sign a funding proposal for new schools or something like that? Ask a few more questions, because if it's this one, please don't help them get it on the ballot.
All right, speaking of taxes, the US House narrowly passed a tax reform bill. There's several elements in there, but what are the most relevant to small business owners?
So this would be this is what that you heard in the news, like the One Beautiful Bill Act. That's literally what the act is called. It passed the House 215 to 214. So as close as it could possibly be, goes to the Senate. So the first thing is this isn't law at this point. It's gone through one chamber. But several things that would matter to small business owners. Some of them are pretty good or quite good. Um, a permanent extension of the 2017 rates. So the rates went down, those would be extended. Elimination of taxes on tips and overtime. So for workers, particularly restaurant workers, but also those working overtime, there are some new tax credits for example, for American-made vehicles. Establishes $1,000 savings account for children, new children born. So it's like a new establish or an incentive, I guess, for kids. But then the there's other more kind of controversial items. There's social safety net issues, both like with food stamps and Medicaid, particularly with work requirements. And then the there is one other item I was like there's this talk of debt and deficit, and I think Sarah, you shared the article. I got into that in the article. As I cover these things, you can see all the kind of elements of the main elements of the bill. The I kind of walk through what it means to where the deficit is headed now, where it would be under a bill of this magnitude. So something to pay attention to, because the U.S. is it really is at a inflection point when it comes to debt, the way that it is accelerated, and something that I expect will get a lot more attention over the coming months.
All right, let's wrap up today's show with a very fast election watch 2026.
All right, so there was a poll, a horse race poll that the Detroit Regional Chamber of Commerce published before their Mackinac Policy Conference. And this poll was done by Glenn Gariff, which is a very accurate pollster in Michigan, accurately predicted the last election in a way that actually the last two elections in a way that other pollsters really missed. When this pollster publishes, I pay a lot of attention to it. Basically, it looks like on the Democratic nomination side, Jocelyn Benson being a clear front runner, John James as a Republican and being a clear front runner. But those two kind of in a horse race, about 36% each, and then independent candidate Mike Duggan at 21%. Most of his support, of course, coming from Southeast Michigan. So that was 36, 36, 21 is where it stands right now. Looks like quite a horse race. Of course, those candidates haven't won the nominations yet, but it looks like they started out a pretty strong position.
That reminds me, I saw my first billboard, and it was for Mike Duggan over the weekend. So it's starting. All right. Well, thanks for the update, Brian, and thanks for everybody for tuning in today. We hope you have a great week. If you're in the Kalamazoo area, we have an owner-to-owner meeting this Thursday. Otherwise, we'll see you back here next Monday at 3 o'clock.
Thanks, everybody. See you next week.